All right, all right. Again, we have another episode of Non-Compliant. I am your host, Manolo. I am here with a very special guest, Dr. Fowler. We have a very extreme story that I would like her to share with you guys. It's definitely deep. It's definitely needs to be reached out to as many people as possible. So with that, I would like to introduce Dr. Fowler. Nice to meet you once again, Dr. Fowler. I appreciate you being here. I appreciate you tapping in with us on Non-Compliant. How are you feeling today?
My dear, first of all, I'm pleased and I'm honored to join you, your listeners, your supporters, those who are with us and those who are not. Thank you so much for inviting me. And I am uplifted today. I'm a pillar of good health, but I'm still burdened with the situation that I'm bringing to you today.
Right. Yes, yes, definitely understandable. I definitely understand. So with that, would you could you start from the beginning and let us know? Well, before we get into that, can you let everyone know a little, tell us a little bit about you, things that you do and where you stand from?
Thank you so much. Yes, I am a doctor of biomedical anthropology. My practice has involved providing instruction, training, and curricula for health providers in the interest of culturally appropriate diagnosis, assessment, and intervention. For many years, I worked in the university system. I taught at Temple, University of Pennsylvania, Drexel, mostly all of the local community colleges, St. Joe's. And I taught, well, in different schools, but mostly my practice was around providing instruction and training for physicians, nurses, therapists, educators in the interest of appropriately diagnosing families and appropriately matching families with the services that they needed, and most particularly avoiding the hazards of taking children into child protective custody without any basis for the need for intervention. I'm a grandmother. I used to consider myself a very, very active person. I like tennis. I like extreme hiking. I've backpacked around the world.
All
And
right.
I was hoping to do that again. And my biggest claim to fame is extreme hiking, where I climbed the tallest pyramid at Tikal in the jungle.
Right, absolutely. All right, thank you, thank you. We truly appreciate that. You're a wonderful, wonderful woman, and we appreciate everything that you do, everything. So with that, let's get into your story. Let's talk about baby Carly, because I understand from the last time that we spoke, there's a lot of things that was going on with that, and just please get into detail with that. If you wouldn't mind, can we start from the beginning?
I absolutely would be so pleased to start from the beginning. I am the court awarded custodial, maternal grandmother of three grandchildren. The oldest is 23, the middle child is 13, and the baby, age 2, is the subject of this discourse. The reason why I have been so involved as a custodial grandparent of my three grandchildren is that my daughter is impaired in her ability to parent. And there are four areas of her impairment. Number one, she has psychiatric illnesses in the acute range, and that would be everything from
Mhm.
schizophrenia, bipolar, personality disorder,
Wow.
down the line. Number two, she has a drug and alcohol problem in the acute range. Number three, she has a profound, fully integrated belief that she can parent and that others, like myself, cannot, despite the fact that my daughter has been repeatedly arrested and convicted for child abuse, child assault, assault of me,
Mhm.
despite the fact that there is a pending protection from abuse order against her right now, which she violated earlier this week, and the court of jurisdiction, which would be Montgomery County, has issued yet another bench warrant for her arrest for something called an ICC, not to insult you or your audience, but that is an indirect criminal complaint, meaning that she violated the order for protection. My daughter finally has a compulsion that, do I still have you?
Yes, I'm still here.
Okay, I didn't see you anymore. Okay. Uh, my daughter also has a unique psychiatric condition, and it's also a condition of the soul, whereby it is absolutely fundamentally important to her survival for her children to be harmed, molested, separated, injured. There must be another fight flight situation with the police, an arrest, street fighting, evictions, injuries with the emergency squad. And most importantly, she has learned over the years to misuse Child Protective Services. In the Philadelphia area, we call this agency DHS, Department of Human Services. She has used that thing as a system to punish her children. So if she sees that the children are happy and they're thriving in any placement other than her own, she will make it her business to make sure that those children are snatched from that happy place, which is usually with me, and thrown into DHS. So
Wow.
for almost 20 years, we've had a horrible situation whereby she will do something to harm or injure the children, and I have spent most of my time that would have been my retirement years retrieving my grandchildren and saving my grandchildren. So my daughter is the first 100% of the problem and the reason why my baby granddaughter has been medically kidnapped. There is no way that the baby could be placed with me that my daughter would say, I'm so happy that my daughter is with my mom while I'm out here wowing out in the streets. That's just never
Right.
going to happen. So another reason why, and it's not really a reason, but due to circumstances, there are other extended kin who would have taken baby Carly, but they all know that they will never see any peace because every single day, all day long, my daughter will be on the hotline alleging horrible things that are not happening. And based on her record and the fact that she's separated from all of her children, no one in a logical world would listen to her. Anyone would perform a safety check and see that the child is fine if there's an intervention and leave the situation alone. But that never happens. She's always taken her word and taken at face value. So other family members are terrified of her. They're afraid that all of these malicious calls to CPS will result in having their children taken away. So that's a
Wow.
part of the problem that she will, yeah, we even had family members lined up to take baby Carly when she was taken from me. My daughter alleged that they were using drugs. They are not. They submitted to the drug test. Who does that if they're using drugs? And they cleared, but she wouldn't stop terrorizing them and tormenting them, and they just couldn't do it.
Wow. Wow. Sorry to hear all that. That's definitely sad. And what you weren't able to find any help from any source going through anyone at all with this situation?
No, I have hired a succession of attorneys who took $50,000 or more and who did nothing but laugh at
Wow.
me behind my back. I have appealed to every agency and every agent. If the mind can conceive it, I've been there because I'm super diligent. I'm hyper diligent. I don't sleep. And when I'm on campaign to save children, there is no stone that I will not overturn, even, and I don't let the idea that, oh, this might not work stop me. I do it anyway. I
Right.
do everything. So I have issued reportage from the U.S. Marshal's Office of Missing and Exploited Children to the FBI. I've met with the CIA, believe it or not. I've gone to political rallies to get to RFK Jr. I have issued reports to the district attorney's office in Montgomery County, and their report is only channeled through DHS. I've attempted, and so my family members have attempted reportage with the Philadelphia district attorney. They won't take a report. I've gone
Wow.
many times to the Lower Merion Police, and they would not take a report against the social worker or the agency. I have been to the Attorney General, the Inspector General, any authorities in the state or at the national level. There's no door that I can think of. Child advocacy projects, just far and wide, and there has been so far no relief in the system.
Wow. Wow. I mean, our systems are, as we all know, really thin to nothing, and it's just sad. But hopefully, like myself, others will hear this and decide to put this on their platform. That this story gets out a lot more. So, far as your daughter right now, what is she seeking any help at all, or is she still, just trying to get it together out there, as I'll say?
Now, last reportage, my daughter is literally living on the street, homeless, eating out of the trash can. And she is chronically arrested. I mean, she's been arrested so many times, maybe more than 100 times. I don't know. At times, she is psychiatrically hospitalized. That's the only intervention that there is for. As you and I both know, they give her the happy meds, and then they just release her from the hospital, and then she's back out on the street again. Recently, as she does every time this year, she shows up at various family members' homes wanting housing and help, but no one can let her in. At this point, everyone now has to call the police on her to get rid of her. Interestingly enough, though, and I'll get to what is medical kidnapping, my daughter doesn't typically, she doesn't hold on to a telephone. The last time she was in my home, she was talking to the walls and screaming at the cyber invaders. But at the same
Wow.
time, each and every time we have a dependency hearing, each and every time where my daughter could come into court and open up her mouth and use the same influence that she uses to keep her children in captivity, even though she doesn't have custody, she still has parental rights. They're very different. It's very confusing if you don't understand the nuances of family law. It's pretty twisted and very sadistic as a
Yes.
system. So the person who should have no voice ever whatsoever could still come into court and say, I want my mother to have my baby. I want my baby out of the system. But interestingly enough, if you wanted to find her today, you couldn't find her. If I were to go out on the streets looking for her, I couldn't find her. But how ironic it is that she manages to show up in court for almost each and every dependency hearing on time and reasonably attentive, but she does sometimes act like a werewolf in court as well. Don't you find that as you hear the story? I don't mean to put this question to you. How absolutely intriguing.
Yes, absolutely. Absolutely.
And her only voice in court is, I want to have my baby. And I don't want, excuse me, nobody else to have my baby but me, and leave my baby alone where she is.
Wow. So at this very moment, do you know where baby Carly is residing at and the people that she's with?
Thank you for asking. My hundreds of hours of investigations, hiring investigators, have yielded two people. I won't say their names on your platform, but the brothers will be publishing their names. The names, addresses, and some background on the two people where baby Carly is supposed to have been placed. These are the quote foster parents, where she was taken from me and put with these people. By the way, after allegations of sexual abuse, the record yields a date and a time that she was taken from these people and put right back with them, interestingly enough. These people reside on Regent Street in Southwest Philadelphia, in the University of Pennsylvania Hospital catchment area. The husband is employed at University of Pennsylvania Children's Hospital in the film department. The wife works at an elementary school. Where is baby Carly is our topic. Just because she's been assigned to them, what is medical kidnapping? Carly could be in China.
Right.
I have not, no one has seen my granddaughter in about 848 days.
Ooh.
So she could be trafficked from place to place, even as far as China. And no, it may sound wild until your audience hears more about what is medical kidnapping.
Absolutely.
Um, and I feel and fear that she has been locked in a cage. I fear and feel that she has been chained somewhere based on an 800-page medical record and what I know about medical kidnapping. At this point, I do not know if she is dead or alive, but I would not be surprised if she's alive or dead to discover that she is missing a spleen, liver, kidneys, any other of her organs, and especially a lot of her biotissue. I'm 1,000% sure that she's been robbed of that because what is medical kidnapping?
Right, exactly. And could you go into a little detail for the audience about medical kidnapping for the ones that don't understand it or never heard about it?
I would be pleased to do so. If I just could make a few words about the background of this situation so that people understand the narrative about what happened. When baby Carla was born, which was May 2022, my daughter was living in my home with a baby. She was homeless. I took her in with the baby. She had the baby so that she could get services and resources. And we were living in another county. This was Montgomery County, Pennsylvania. Well, later on, it'll be important to note that the baby was domiciled with me, which in legal language means that she was living with me under my care and protection. And during that time, I obtained full legal and physical custody of her as an attachment of my protection from abuse order against my daughter. So on August 22nd, 2022, yes, I had a PFA. It's a very complicated family situation. I can't quite put her out because she's got the baby. She knows that. But when she starts hallucinating, and we have to take the knives out of the kitchen,
Right,
we're coping with that situation at the same time. So this is a family situation.
right,
I told my daughter August 22nd, do not go to Philadelphia. It's hot. There's still COVID. Do not take that baby. Do not, do not. She went to Philadelphia. She was discovered in the Logan area of Philadelphia by Philadelphia police in a public bathroom in what the order for protective custody describes as being in a catatonic and unresponsive condition. The baby was with her. CPS, rural DHS in Philadelphia, was called. DHS called me. I went to the scene at Einstein Medical Hospital, picked up my infant granddaughter, who was 5 months old at the time, and brought her home. After I signed kinship award papers in the parking lot of Einstein Medical abroad in Albany, I waited. By the way, a small interjection. I am a certified foster parent. I have all my
okay,
FBI clearances. I'm also a medical waiver provider. So I have to dispatch all of my clearances all of the time. I
right,
have an impeccable record, and I was certified as a foster parent by the same agency that decided to take her, which lets your audience know that clear their minds about, well, what could be suspect about grandmother's handling. I've also fostered 11 other children. I've
right,
dedicated my whole life to children. So with my experience, especially also as a professor at a university teaching social workers about social systems, I'm very familiar with the three instruments that should have been given to me by August 24th, 2022. That would be 2 days after DHS intervened. We didn't need their intervention. I didn't want their intervention. I live in another county. They should have just said, here's your baby.
right, exactly.
But they kept the case open. I was expecting the delivery of three things, not to insult you or your audience, but for anyone who becomes a kinship caregiver, you are due three things. Number one, your shelter award, it's an order for the shelter placement.
Okay,
That means that as soon as that child is taken into custody, there's a court hearing, you're never there. But a number of panel stakeholders are there. They decide two things: where the child is to go, and if there are going to be family visits by the parent. It's a boilerplate instrument. I was due my kinship award letter that specifically names me Unlike the order identifies me as MGM, maternal grandmother. The kinship award letter names me specifically and endows me with the powers to resource that child for their education and their medical so that I can present it to any school or anybody and say, hi, I'm here and this baby is placed with me. Number 3 would have been a safety plan. Parents who really know this don't sign the safety plan, and it was my option to sign it or not. I wasn't going to sign it, but I wanted it because it's mine. It's like your mail. Those are 3 instruments that the social worker should have visited. Upon visiting me in my home within 72 hours of captivity, she or he should have brought me those instruments in person as they conducted an inspection of my home. In this case, the social worker who had already been involved with my middle grandchild, remember we've never gotten away from CPS, told me, these are her exact words, I'm not going to give you those papers, you filthy dirty Jew, because I'm going to take that baby away from you. I'm going to take that baby away from you. So when people ask me why, here is why. She's in violation of every court statute and every procedure because these instruments are not hers to withhold. They're mine. They must be delivered to me. This is statutory. Then from there on, she began, this social worker from KUA number 5, again for your listening audience. KUA is short for Community Umbrella Agency. In the city of Pennsylvania, when the Department of Human Services intervenes with a child, they do the initial processing work and the initial court work and so on, and then they pass over all of the administrative responsibilities, the oversight, the monitoring, the family plan, to one of these community umbrella agencies. There are 10 dispersed across the city. The purpose of these agencies was to keep families together, to keep children in need in placement with their families by law, by statute. In this case, KUA number 5, 3300 Henry Avenue, lead social worker and supervisor, who, by the way, is not even licensed, according to my investigation, decided that she was just going to send her worker to show up at my house to just take baby Carly one day because, in her opinion, I wasn't compliant with something or another. We turned her away, called the police, they made her leave for lack of jurisdiction. That didn't work. Then she reached across jurisdiction and wrote to my court of jurisdiction and asked my court to take away my custody.
Wow.
You don't want to take away something that doesn't have power. She knew the powers of it, and she wanted that baby so desperately. Then Miss, I don't know if I can name her on your form here, but I will name her later. Her name is in the public purview. She began to literally stalk me, harass me, terrorize me. The messaging was, I'm taking that baby, until October 7th, 2022. I didn't know myself that morning at 9:30 that I was going to be taking baby Carly to the hospital in my jurisdiction for her lab work. I made a last minute decision. On this day, however, at the same time, my brother wasn't with me and my paid hired protection was not with me. Yes, I had been driven to the point where I went to an authorized company and I hired 2 armed men in black.
Right.
For my safety and protection from this woman.
Wow.
As I emerged from the lab at 9:30 in the morning to sit down and feed baby Carly and begin my own day-long reportage of the social worker to the hospital. We were going to map out the epidemiology. I was going to order the placenta testing. And with each stop at the hospital, I was going to report on this social worker because I too am a mandated reporter. As I came out of the lab, there was this social worker's worker, her henchman, demanding possession of the baby and telling me I wasn't feeding her correctly.
Wow.
Now her diet had just been improved 3 days before, demanding the baby. I was so terrified. I know something about the system, but with these systems, the more you know, you don't know anything. The more you try to uncover, the less you know. All I could think of at that moment is that this woman is like a blind dog in a meat house with her hunger and thirst for this baby. And she will do anything to get this baby. My only thought was, I wish I could pull it up for you, was to, first of all, take a picture of the baby and record what happened, what was happening, and then take a picture of the food, and then take her food and pour it out into the garbage, and take the containers and put them in my bag, because I knew, criminal mind, that they would pollute that food and say that I did it
Right.
later on.
Right.
And all I could think of was that this woman will now try to get some kind of an injunction from the sheriff. Sooner or later, I will go to my door and the sheriff will be at my door. Now, not just demanding the baby, but my liberty. That's all I could think of.
Right.
So there she went. I'm so sorry. How much more time do we have for me to get into the crux of what is medical kidnapping? Now that I've described the scenario.
We have a few more minutes left. Yeah, could you jump right into that for us and let the audience know? We definitely appreciate everything that you're saying, because this needs to be heard. But yeah, definitely, can you let us know about the medical kidnapping?
I certainly can. Medical kidnapping has been occurring for many years. It especially with University of Pennsylvania Children's Hospital. They had a horrible reputation for their maltreatment of Black babies and Black mothers delivering babies in their system. Here is medical kidnapping. One of the ways your children can be medically kidnapped is if DHS or CPS has had any involvement with your family before at all. Even if they simply got a referral and said, oh, okay, we see there's no problem. There is a problem because you're in the system and they are tracking you now. So if you have a new child or new children come into your home, they are tracking you. And they are heat-seeking missiles looking for infants in particular for this medical industry. Another way that children can be taken is if there is domestic violence or domestic situation in the home, and one of the partners happens to call law enforcement. If CPS is alerted, then they're alerted that there's a child that they can snatch, or sometimes just happenstantially if you are birthing. In my case, CPS and this social worker issued a manhunt, dead or alive, for my granddaughter because my middle grandson and my older grandson had already been involved in the system. So the social worker decides that they want this particular baby. Black American babies are at the top of the list. Why? Because we are the result of genetic experimentation. We are the most successful, shining genetic engineering project experiment in the world. You and I both know that we are genetically manufactured based on the breeding plantations. Thomas Jefferson had a formula for how to breed so many crossings of a mulatto and a quadroon and so on. And because of our amazing admixture, we're the most resilient gene pool in the world. I'm sorry, this is Alma. She thinks she owns me. Not necessarily the strongest. It's not the strongest that survive. It is the most diverse